for him or
For sure, because
yeah.
they say with MDMA, it quiets. Again, I'm not a special on this. This is just things I've read, so please, fact check me.
Yeah.
But like the MDMA is supposed to quiet the amygdala, which is
Hmm.
supposed to be
Emotion.
essentially emotion, but also the fear center.
Yes.
So if you quiet all the fear center, you just feel like safe and love, and you can see parts of your life and people in your life differently because they aren't wrapped in a sheath of fear or judgment of, will this person stop loving me, they did this thing to me so I'm offended, like all of these things. You don't really see that anymore. You just see love and who they are, for better or for worse. So
Hmm.
that's essentially the idea of how they think perhaps you can begin to recode memories going through this journey with MDMA, because like EMDR, you're able to see it without the fear center on, and you're kind of just there are different modalities, but I think like the central idea for me seems similar. What do you think?
100%. I think, and what we know about trauma is that often when we're in a, and back to what you said at the beginning, I just wanted to note, because I think it was such a key thing that you said was trauma. We no longer think of trauma as like, we say big T traumas, right? Like abuse or an accident.
Right.
We think of, and trauma we now know is all about perception. It's all about how you perceive something. So like I could experience something, no issue. You could experience it, and the way you've perceived it is traumatic. So it's actually not about the event, it's about the perception of the event. It's about the impact of the event or chronic event, or like you said, we now know like
Mm,
living in poverty is trauma, right? So it's this repeated kind of chronic stress that becomes
right.
trauma over time, and it's the perception of that. Or if you lived in poverty and you lived with like a very like, beautiful household that kind of held you, and you were kind of bubbled, so to speak, from the impact of that, you maybe wouldn't have found your childhood traumatic, but someone else living in poverty in a different family maybe would have found that traumatic. So I just want to say that because you said that at the beginning, and I was like, that's such a brilliant point, that it's not trauma. When we say trauma, like when I say I'm a trauma therapist, people think, oh, well, like you work with like, ugh. And yes, I do, but I also work with
Right.
this like with folks who are just like have, or I say to them like, you, that sounds like you have a really traumatic response to that. And they say, oh, no, no. But then when we unpack it, it's like, yeah,
Right.
like your nervous system, your brain encoded that as trauma. Like
Right.
you were so activated in your, like you said, like your limbic system, which is amygdala, hippocampus, like all those structures were
Right.
so activated for whatever reason, how you perceived it, how you experienced it, that this is trauma, right? So
That's really interesting. So yeah, so if even when you're saying to clients that know they have something to be excavated, and you say that
mhm,
sounds traumatic, they're like, "Hold on here.
yeah, yeah, they're like,
It's not
no,
that, like, because I think there's such a stigma around like, oh no, it wasn't that bad, but like the way
exactly.
you're emotionally dealt with it. Like, let's say how you said the person that maybe comes from a wealthy family and they don't have those trauma of poverty. But let's say they have a parent that for their entire childhood never said that they love them or
Just as
showed them
traumatic.
any appreciation or
Just as traumatic.
right.
Yeah.
And so,
Yeah.
and it's not like a it's not being hit, it's not being sexually abused, but like you go through life thinking that your closest caregiver doesn't care about you or like that is traumatic, and it will change the way that you deal with relationships. It will change how
100%.
you look at the world and yourself.
And
So
can be just as traumatic. And as
I like
Imogene,
big T little T trauma. I like that. I like that term.
and I'm getting a lot of clients now. This is side note, but it's really interesting kind of what you're saying. I'm getting a lot of clients now in their like 50s, 60s who are coming to therapy and saying like, I didn't have this bad childhood, but like I have all these things, and it's for exactly what you're saying. Like, they're like, I wasn't hit, right? Like I wasn't hit,
Right.
I wasn't sexually abused. Like what's my issue here? Like I should be okay. And so you start to unpack it and realize like, well, you didn't have a very like a attuned caregiver. They didn't really meet your needs. Like you kind of, when you were upset or no one really kind of told you that was okay or helped you manage it, like that is just as damaging as being differently, but like being hit as a child. So people are now, I think, starting to come and realize like, okay, just because you didn't have like the traumas that you're describing doesn't mean that it wasn't as
Right.
painful and as impactful. So Yeah.
I wonder if there's people that are like in their 50s and 60s or 40s, and they're on Instagram and they're like, I was following this therapist and I think I need to talk to somebody. And like, because like sometimes
Yeah.
you won't even think that these are things that are latent. You're just like, well, I didn't get thrown down a flight of stairs. I didn't see my mother or father throw anything at the other one.
Yeah.
So like,
Yeah.
I'm good, right? Like,
Yeah. Oh,
I'm good, right?
people invalidate their own pain, right? They invalidate themselves because they're like, well, people have it worse. But the whole thing is it's about perception. And like if you're a highly sensitive person,
Right,
I am one. The way my nervous
right,
system and the way I perceive things, can be like very like deep for me and for other folks who
sure,
are like highly sensitive, right? So it also depends on like your
right.
temperament. Like there's so many factors that we're starting to really understand, I think, in the field. And I think that's why it's kind of opening the door to some of this, like what you're saying and realizing like there's blocks here and I don't know
Yeah,
how to kind of
unblock.